Joining us now to talk about the COVID-19 data trends is Dr. Bala Hota, a doctor with Rush University Medical Center. Doctor, thanks for being with us.
Nice to be with you.
Well, let's get to it here and talk about your thoughts here as we now begin to enter a new phase of this second surge. And what are your biggest concerns heading into the winter months?
Yeah, well, we are definitely seeing an increase in cases in our community. Just looking at the Rush system, we've seen a pretty pronounced increase in the western suburbs that's been going on for about 2 weeks. And over the last 10 days, we've absolutely seen an increase in cases at the main medical center down in Chicago, where we've had, in the last week, more than doubling of the number of cases that we've admitted to our hospital. We're activating some of our surge capacity to open up increased ICU beds. And I think this is just really reflecting that there's pretty uncontrolled spread in our communities. And so the measures we can take to reduce that spread, I think we all have to sort of do that at this point.
And Dr. Hota, do you think that things are worse than they were last spring when it first started? And we're saying no Thanksgiving. I can't see where you can have Christmas either.
Yeah, so I think in some ways we're better, and in some ways we have to see what's going to happen over the next few weeks and really what choices we all make as part of the community. In ways in which we're better, there's just a lot more known about the illness. We're seeing our lengths of stay among our patients go down, which means that more patients are recovering faster. So that's a good thing. We also have treatments. The Lilly monoclonal antibody was just approved and will be coming online for hospitals. We have remdesivir as a drug. We have steroid treatment for hospitalized patients. So a lot of different opportunities in terms of treatment and clinical pathways. Where I get a little worried is the winter is, to begin with, always a time where we worry about the flu season and hospitalizations due to respiratory illnesses. And we, have been talking about this idea of a twindemic, so flu and COVID. And we're starting to see now those increases in COVID cases. Now is the time where we should all really double down on trying to prevent new infections. So wearing masks, washing our hands, employing social distancing, really trying to reduce the likelihood that new cases will spread. And some models are showing if we can get to 95 to 100% mask use, if we can take measures like the governor announced today, we may be able to have an early peak and a decline. If we don't make those measures or those changes, it might take until January for us to see a peak.
So I was going to ask, what do you think is going to be the timeline here, and why do you think we're experiencing this, this second surge here? Do you attribute it to this COVID fatigue, or is it just a simple case of more people are retreating indoors because of the cold weather?
Yeah, I think, we've been talking about this. I think it really takes two things independently for COVID to take hold in the community. And so one is, to what extent are we using the measures that we've been asked to do, face masks, social distancing, hand washing, trying to take those precautions, avoiding large groups. And then the virus has to get introduced into the community. So over the summer, we did see a decline in cases. Maybe we all got a little tired of it. But now it's back. It's back in our community. And so it's those two things together, our fatigue plus it's here now. So it's the time to sort of, put those measures back in place.
And Doctor, we have two possible vaccines on the horizon. But once we are vaccinated, it's going to take a while for everyone to get vaccinated. Then, after we've had the booster and everything, then are we immune? Are we safeguarded against the vaccine? Can we go on about our business? Or will we have to take more vaccines moving forward?
Yeah, it's really too early to tell, but it's been amazing the amount of science that we've seen. To have a vaccine candidate in less than a year with a over 90% efficacy, and then to have two is extremely exciting. But it's too new for us to know how long the immunity that this vaccine could provide will last. And we just have to keep watching the data. And I think we'll kind of see what that shows as the trial progresses.
Wow.
All right, Dr. Bala Hota with Rush University Medical Center. Doctor, thanks for your time and your thoughts tonight.
My pleasure.